Scientists across the world are racing to develop a coronavirus vaccine. But once a vaccine is developed and approved, who gets it could be highly dependent on the 2020 census, which is already underway.
If in a year or 2 years from now, we finally have vaccines, the first thing that public health folks are going to do is they're going to look at the census counts by neighborhood and say, where do we push out vaccines?
This year, getting an accurate count of the US population by the December 31st deadline might be much harder because of the coronavirus.
If people don't participate, then they're at risk of getting less vaccine than they should have gotten. It has real implications.
The census results also determine where federal funding goes.
Some have actually said that it's trillions of dollars, billions and billions of dollars every year flow down to the local level and are used by decision makers to make informed decisions about roads, schools, healthcare.
Whether it's funding for hospitals, Medicaid, or children's health insurance, the US government looks at census data to figure out how to allocate resources during a health crisis, like the coronavirus pandemic.
An accurate 2020 census does bode well for times when emergency preparedness or first responders need that information. Looking at the health industry and everything that's happening with COVID-19, the official statistics of the United States definitely will be used and come into play.
Historically, though, minority groups such as African Americans, Latinos, people on tribal lands, and other rural populations have been the hardest to count.
These are considered hard to count communities for a couple of reasons. One, little to very limited access to information around the census and around most civic engagement issues. I think another piece is there is a huge distrust for government.
Which is why the Census Bureau sends field workers to knock on doors to collect data. They also reach out in person to the homeless and those living in transitory locations like campgrounds, RV parks, and hotels. But during the pandemic, collecting data in person poses a huge health risk. That's why all field operations have been suspended until after April 15th, as the Census Bureau tries to figure out how to protect the army of door knockers from COVID-19. Meanwhile, the agency is urging folks to fill out the form online or over the phone.
However, it puts the hard-to-count populations in an even more difficult situation, because the people that have historically been the hardest to count are the ones that require individuals to go knocking on doors to secure their participation.
Advocates also worry that the census is just not a priority during the pandemic.
It is very hard to, in a moment where we have a global pandemic and where people are struggling to figure out how they're going to put food on the table if they're losing their jobs. Amidst all of that, to ask folks to prioritize the census is a very difficult thing.
Despite the challenges presented by the coronavirus, census officials say there's not much flexibility to extend the deadline since the US Constitution mandates a census every 10 years.
But when and where possible, we're making adaptations and modifications to all of our operations to ensure the safety of the public and our staff, because we, just like everyone else, we're practicing social distancing and we're ensuring that we can lessen the spread of COVID-19.